Namaste everyone. So in today's session of yoga therapy, we are going to learn about the peptic ulcer. So let's begin the session. Peptic ulcers are particularly called as the open sores that develop on the inside lining of your stomach and the upper portion of your small intestine. The most common symptom of a peptic ulcer is a stomach pain. Okay. Peptic ulcer includes gastric ulcers that occur on the inside of the stomach, duodenal ulcers that occur on the inside of the upper portion of your small intestine, that is the duodenum. The most common causes of the peptic ulcers are infection with the bacterium, which is called as the Helicobacter pylori, which is the H. pylori, Helicobacter, and also long-term use of the non-steroidal anti-inflammatory drugs, which is known as the NSAIDs, such as the ibuprofen, which includes the Mortin IB and other drugs as well. Stress and spicy foods do not cause peptic ulcers. Okay. So, however, they make sure your symptoms worse. So symptoms like, for example, burning, you can find the stomach pain, feeling of fullness, bloating, blenching, intolerance to fatty foods, heartburn, nausea, etc. The most common peptic ulcer symptom is burning stomach. Burning stomach pain you will find out. Stomach acid makes the pain worse because your stomach goes upward and upward in the direction of the upper part of the esophagus, as does having an empty stomach. The pain can often be relieved by eating certain foods that buffer the stomach acid or by taking an acid reducing medication, but then it may come back. The pain may be worse between meals and at night. Many people with peptic ulcers doesn't even have the symptoms. Less and often, ulcers may cause severe signs or symptoms such as vomiting or also vomiting blood, which may appear red or black, dark blood in the stools, or the stools that are black or tarry, trouble breathing, feeling faint, nausea or vomiting people can find out, unexplained weight loss also, and also one of the things that you can find, the appetite changes. So what are the common causes of the peptic ulcers? So common causes of the peptic ulcer is all about the bacterium, which is called as the Helicobacter pylori. Bacteria commonly live in the mucus layer that protects your tissue that line the stomach and small intestine. So what happens in our stomach? There is a line by which this bacteria protects it. So often the H. pylori bacterium causes no problems, but it can cause the inflammation of the stomach's inner layer, producing an ulcer. It is not clearly how H. pylori infection spreads, but it may be transmitted from one person to another person by the close contact as well, such as you can say with the intimate postures and etc. People may also contract H. pylori through food and water, regular use of certain pain relievers, taking aspirin as well as certain over-the-counter and prescription, the pain medications called as non-steroidal anti-inflammatory drugs, which is called as again NSAIDs, can irritate or inflame the lining of your stomach and the small intestine. These medications include another medication such as ibuprofen, Mortin IB, etc. So other thing is that they do not include, you can say, the acetaminophen, which is called as the tenol, others and other medications, etc. Taking certain other medications along with these drugs, NSAIDs, such as the steroids, low dose aspirin, it can, increase it. So what are the risk factors? The risk factors called as smoke. Smoking may increase the risk of peptic ulcers in the people who are infected already infected with H. pylori. Drink alcohol. Alcohol can irritate and erode the mucus lining of the stomach and increase the amount of stomach acids that's produced. Having untreated stress, eat spicy foods, etc. See, everybody has their own things. Every person, if are dealing, let's suppose some people are taking just only spicy food, so it can enhance the peptic ulcer, but not every time. Okay, so for example, performing asana. So what you can do, I will recommend as a yoga therapist in the section which I have recommended to you, the constipation also, that it is also the digestive organ problem, peptic ulcers. So that particular asanas, pavan muktasana, child pose, L shape, vipreet karni, you can practice. Pranayam, alternate nostril breathing, and also the Shitali and Shitkari. Why? Because in peptic ulcer, the Pitta dosha is increased, which generates the heat more and more. So to reduce the heat, we have to indulge those practices which can relieve and give the cooling effects. The cooling pranayam, which is the Shitali, Shitkari, and Ujjayi, is for the tranquilization you can practice. So what are the diet and nutrition you can do for it? Avoid dairy products, caffeine, alcohol, too much of sugar substances. Okay, eliminate, because some people are taking too much of oil, too much they are doing it. So eliminate those. Increase high amount of good oil, like those increase HDL, high density cholesterol, not the LDL part. Include such as you can say the burst sprouts, cauliflower in the diet. Sulfur is also the precursor to the glutathione that provides the antioxidant and protects the gastric mucosa. So have those things. And also bananas, such as the fruits which contains the potassium and plantain, which also yields the benefit. Buttermilk is also one of it, because it can normalize your bowel flora and inhibit the H. pylori infection, which is already there, or increase. Vitamin C containing foods like citrus fruits, orange, pineapple, strawberry, etc. is also very good for the food. And include those diets which includes the zinc containing foods, for example nuts, seeds, cereals, and also soya beans, vitamin E, A, and glutamine, which promotes the healing of the ulcers. Okay, vitamin E is also good for it. Cabbage, you can take juice, high in glutamine, and although it may initiating in this way. So this is all about for the yoga therapy and the diet. You should take care of it and drink the good amount of water as well. Thank you so much for joining this session of yoga therapy.